Hello my dear students, I am Dr. Vaishaly Bharambe. I have been teaching anatomy for the last 25 years and I love it. Before I start my today's lecture, a big thank you to all of you for seeing my lectures, appreciating my lectures and more importantly, learning from my lectures. Okay, let's keep this up and let's study today's topic, which is hip joint 1. Okay. Students, understand that whenever you are studying any joint, there is a pattern along which you have to study it. What is that pattern? First, is the joint having another name? Second, what is the classification of the joint? What are the bones forming the joint? Not only you know the names, you have to describe the bones. What are the ligaments forming the joint? Enumerate the ligaments, describe the ligaments. What are the relations of that joint? What are the movements? What are the muscles bringing about the movement? Blood supply, nerve supply, applied anatomy. This is how you cover any joint. My suggestion, quickly take a screenshot of this. Okay, study every joint along the same pattern and you will be having benefited from this method of study. Right. Today I am going to take this lecture in two parts. Hip joint 1 covers the first half. Hip joint 2 covers the second half as seen here. Okay. So let's begin hip joint 1. One little request to all of you students. Please sit with a femur and a hip bone of the same side. So when I ask you to articulate, you should be able to do so. Right. So using the pattern, my first question is, does hip joint have another name? Yes, it does. It is called as the Acetabulo-femoral joint. Now I want you to classify the joint. You will say, ma'am, it's so easy. It's a ball and socket type of joint. But you knew that in your 7th standard. From 7th to 1st MBBS, have you not progressed? Then reflect that in your answer. So, question is, does the joint have a cavity? Yes, it does. So, it's a synovial joint. How many bones are forming the joint? Ma'am, there are 2. There is femur and there is hip bone. If there are only 2, then it's a simple synovial joint. Of which type? Yes, it's a ball and socket. And because it's ball and socket, how many axes does it move around? Multiple. Therefore, it's a ball and socket multi-axial joint. Now classify the joint as synovial joint, which is of the simple ball and socket multi-axial variety. This is how you classify joints in medicine. Okay, right. The next question is, what are the bones forming the joint? There are 2 bones, hip bone and femur. I have told you that you will have to describe the bones. So, do you have to describe the whole bone? Not at all. You have to describe the acetabulum of the hip bone and the head and neck of the femur, which actually form the joint, right? So, you only have to describe the acetabulum and the head and neck of the femur. That is all you have to describe. Don't describe the whole thing. Right. So, here on the screen you are seeing the acetabulum. It's a cup-shaped fossa. You can see that it shows a horseshoe-shaped articular facet with a little notch inferiorly. That notch is breached by the transverse acetabular ligament as seen, to which is attached the ligament of head of femur. Please keep noting all this. Every word I am telling you is important. Okay. So, an articular surface which is horseshoe shaped shows a notch. The notch is crossed by transverse acetabular ligament, to which is attached the ligament of head of femur. Everything matters. Okay. Right. Finally, in the center, I can see an acetabular fossa. Okay. And along the edge, can you see that bright green colored line? That is the attachment of acetabular labrum. Each of these you must know and you must be able to demonstrate on the bone. Okay. This is for your information. So, this is my acetabular cavity. This is my acetabular articular facet, fossa, notch, transverse acetabular ligament, acetabular labrum attachment. Got it? Okay. Right. So, let's now talk about the femur. Which part of femur? The head and neck of femur. What do you know about the head? Head is almost 2/3 of a sphere. It's not just a gentle curve, it's 2/3 of a sphere. Okay. And at the tip of it, take a look at this image now. At the tip of it, it shows a tiny depression which is called as the fovea. Why is there a depression? Surely there is a cause for it. Yes. So, it gives attachment to ligament of head of femur. Pause. Where was the original attachment of ligament of head of femur? We just saw it a minute back. It's attached to the transverse acetabular ligament. Okay. Right. In this second image now, you can see how the head of femur is covered by a hyaline cartilage, and the head is attached to an elongated neck which is attached to the rest of femur. So, we have covered the bones forming the joint, we have talked about the acetabulum, we have talked about the head and neck of femur, which together form your hip joint. Now, what is the next topic we should be discussing? Yes, we should be discussing the ligaments of the joint. Okay. So, let us begin. This is the enumeration of all the ligaments. Ma'am, there are too many ligaments. Yes, actually there are only 8 ligaments. When you do knee joint, you will get 12. So, this is a better option. Anyway, these are very easy ligaments. I am sure you will find them easy to understand as well as recall. Like I told you, hip joint is a topic, if understood, has got very good recall. So, don't worry. Fine. So, let us begin the description of the capsule. Note, this is important clinically. Not only because as an anatomist I want to describe it to you, it is clinically relevant. Okay. So, why does hip joint have a capsule? It is one of the most important joints in your body. It transmits your weight. If your hip joint is gone, you will not be able to move at all, because now your joint refuses to transmit weight. So, the acetabulum and the femur have to be firmly held together so that the joint remains and it is able to transmit your weight and you can walk around. Crucial. So, what is the function of the capsule? It holds the acetabulum and the femur together. Right. So, take a look at this image now. Can you see a dotted green line here? Okay. This dotted line is where there is attachment of the capsule of hip joint. Okay. So, along the edge of the articular edge of the acetabulum, only superiorly it shows about 0.5 centimeter above the attachment. Inferiorly, it gets attached to the transverse acetabular ligament. So, this is the superior attachment of the capsule. Where do you want the inferior attachment? Obviously, on the femur. Okay. Just remember, on the femur, it is attached anteriorly to the intertrochanteric line, posteriorly to the intertrochanteric crest, but 0.5 to 1 centimeter medial to it. Okay. So, let us take a look. Okay. On the femur, it is attached on the intertrochanteric line. Posteriorly, it is attached to the intertrochanteric crest, just a little medial to the crest. Okay. That is the capsular attachment. Question is, what is so important about it? It is very important. The fibers of the capsule, as they reach the neck of femur, begin to travel upwards again. I want you to imagine this. Okay. The fibers have come to the femur. Okay, and then they curve inwards again beneath the synovial membrane, and what happens here is creation of retinacular fibers. Please, can you write this down? Retinacular fibers. So, capsule not only holds the femur, look at my fingers now. It grasps the femur, and then the fibers turn inwards again and begin to travel back towards the head of femur. These fibers which have turned inwards and have started to go to the head of femur are called as retinacular fibers. Okay. Now, you must think, why is madam teaching us all this? What is the reason that we should know the retinacular fibers? Take a look at this, you will understand. So, what happens is, beneath the retinacular fibers, these retinacular arteries, can you see the retinacular arteries I have shown here? Look at them in the image also. These retinacular arteries travel beneath the retinacular fibers. Can you see that they are going towards the head of femur? So, now they go and supply the head of femur. So, not only does capsule hold the bones together, it is also responsible for allowing arteries to go and supply the head of femur. These arteries, which are retinacular arteries, are actually arteries coming from the lateral and medial circumflex femoral arteries along with superior and inferior gluteal arteries. I will discuss more about it subsequently. Right. So why are we talking about them? We are talking about them because, did you see the fracture happening here? Take a look again. Can you see that the neck of femur is getting fractured? As the neck of femur is getting fractured, which are the arteries that are getting torn? Yes, the retinacular arteries are getting torn. That means that once these arteries are torn, there will be no blood supply to the head of femur. Now try and heal this fracture. Can you heal it? You cannot heal it because the head of femur is getting no blood supply, it begins to degenerate. This kind of degeneration is called as avascular necrosis. I am going to repeat all this, don't worry. This is the first time information is coming to you. When we repeat it, you will understand it well. So, the head of femur no longer gets blood supply and slowly begins to undergo what is called as avascular necrosis. Okay. So, such a fracture cannot heal. It goes into non-union, which this is what happens in elderly people when they have fractured neck femur. In today's time, there are better options, but when I was in medical college, we used to say that fractured neck femur is the beginning of the end. End of what? End of life for that elderly person, because this is what happens. Retinacular arteries no longer supply the head of femur, which with time undergoes avascular necrosis. So let's go back to the beginning of this discussion. We talked about how capsular fibers passed along the neck of femur back towards the heart. Such fibers were called as retinacular fibers. Traveling beneath the retinacular fibers were arteries called retinacular arteries. In a fractured neck femur, if the retinacular arteries are cut, there is no blood supply or reduced blood supply to the distal end or the head of femur, to be precise. Such a lack of blood supply leads to avascular necrosis of head of femur, which finally leads to non-union. Put this in your brain. This is a topic that I will discuss once again with blood supply, so you will revise it once. Don't worry about it. Right. So we are now done with the capsule. Students, before we go ahead, if you are enjoying the lecture, do give a like and subscribe to the channel. It encourages me to make more videos. Also, I have started to put up MCQs on every topic on which I make videos on my website. Do visit and solve those MCQs for practice. It will give you an idea of how much you are understanding in the subject. Of course, there is a whole range of MCQs, tough ones as well as easy ones. Go and take a look. Right. If you're done, let's take it forward from here. One question to all of you. What is zona orbicularis? Now, zona orbicularis are inner circular fibers of the capsule which grip the neck of femur, sometimes asked in vivas. Remember, your capsule is slightly weak on the inferomedial side. See, this is your inferomedial side. It is here that the capsule is slightly weak. So, if you begin to hyperabduct the femur, it is likely to pop out, causing dislocation. So, inferior dislocation of femur is a possibility because inferomedially the capsule is slightly weak. That completes the topic of capsule. Let's go ahead and talk about articular cartilage and synovial membrane. This is common sense. Every surface which is articular will always be covered by articular cartilage. So that means the acetabular horseshoe shaped facet will be covered by articular cartilage. So will the head of femur. Okay. What about synovial membrane? Again, common sense. Common sense is always your biggest friend. Okay. So we know that synovial membrane lines the joint cavity at all places where there is no articular cartilage. Look at the image to understand. So throughout you can see the thin orange line, which is the line indicating synovial membrane. It lines the cavity at places where there is no articular cartilage. It also goes on to enclose your ligament of femur or ligamentum teres. Okay. What is the function of synovial membrane, students? Can you tell me? Yes, every time synovial membrane produces synovial fluid, which helps in easy articulation between the two bones. 1. Second is synovial membrane is phagocytic by nature. If there are any particulate matter floating around in your joint, synovial membrane will try and grasp and phagocytose those. Right. So, we are now talking about acetabular labrum, which is the next ligament. Acetabular labrum is a fibrocartilaginous labrum, triangular in cross section. It deepens the acetabular socket and goes and grasps the head of femur, causing the joint to become more stable. Very important, remember it. Right. So, what happens sometimes when there is a massive trauma to the hip joint? Okay. Sometimes your femur, please wait. So, this is how your normal joint is. In case of massive injuries, the femur just pops out and goes back. Let's do that again. Femur is articulating. In case of massive, suppose there is a hit from the front, the femur just pops out. Okay, this is posterior dislocation. But while it is happening, the acetabular labrum gets outturned. Can you imagine that? The acetabular labrum, which is attached to this edge, just turns outside, and after the femur has gone in, might become inturned again. Now you cannot reduce the fracture or you cannot reduce the dislocation because the labrum itself begins to interfere with the process. In this case, you might have to definitely carry out a surgical intervention for reduction of the dislocation. Okay, so that's the function of acetabular labrum. Transverse acetabular ligament, ligament that crosses between the two edges of the acetabular notch, gives attachment to the capsule of hip joint. Also gives attachment to your favorite ligament. Which one? Yes, ligamentum teres femoris. Before I go ahead, remember ligamentum teres is something that is all over the body. You got so many ligamentum teres. And in the Viva, they will ask you what is the difference between ligamentum teres and ligamentum teres femoris. You find out. Okay. So fine. So attached to this is the triangular ligamentum teres femoris. It's triangle. The base of the triangle is attached to the transverse acetabular ligament. Where is the apex attached? Yes, obviously to the fovea, to the pit on the head of femur called as the fovea. You can see it here. That's the ligament of head of femur, and that's the ligament of head of femur attached to the fovea. Now you must be wondering, such a thin ligament, what exactly is it doing? You are absolutely right. It has got no structural significance. It is significant only because it carries branches of obturator artery and medial circumflex femoral artery to the head of femur, supplying upper 1/3 of the head of femur. Blood supply to head of femur is something you should know in your middle of the sleep also. If you are woken up, you should be able to tell. Branches of obturator artery, branches of medial circumflex femoral artery supply the head of femur, and carrying branches to the head of femur is the function of ligamentum teres femoris. Right. So now I am going to take you into a diagram which will help you to understand this and consolidate your knowledge. Okay. So let's begin. Are you ready? Take a packet of color pencils and drawing sheet and let's begin a diagram. Here is your articular fossa. Inside which you have the horseshoe shaped articular surface, which is lined by articular cartilage. At one end it shows presence of an articular notch, acetabular notch, which is covered by, crossed over by the transverse acetabular ligament. Keep drawing, coloring, labeling simultaneously, dear students. In the center, it shows presence of a fossa which is called as the acetabular fossa, which contains Haversian pad of fat. Attached to the transverse acetabular ligament, this is your triangular transverse acetabular ligament. Again, color it. Right. Now let's add to this the beautiful acetabular labrum. The acetabular labrum is attached along the edge of the articular surface as shown. This helps to deepen the acetabular socket and grip the head of femur during articulation. Finally, let me add the capsule to this. It gets attached along the transverse acetabular ligament, along the edge of the acetabular labrum, 5 millimeters superiorly, again along the edge of acetabular labrum, and back to transverse acetabular ligament. Okay, because it's a capsule and I want it to show differently, I'm going to draw it in a dotted manner. Show it in this manner so that it stands out well. Again, helps you to clearly define what you're trying to say. There. So that's the diagram I wanted you to understand. It shows you the attachment of the capsule, acetabular labrum, horseshoe-shaped articular cartilage, central acetabular fossa containing Haversian pad of fat, transverse acetabular ligament, attachment of ligamentum teres femoris to this, all this in a single diagram. So we'll now take on the second diagram for today, which is a coronal section through the hip joint. Ready? Let's begin by drawing first the neck of femur. This is the neck of femur. You can continue this up here to form the greater trochanter and down here to form the lesser trochanter. Later on, we might need to color this, so that I'm joining this off. Over here now, I'm going to enlarge it to form the head of femur. At the center of head of femur, students, what should I draw? Yes, I should draw the fovea or the pit. On the other side, here you are seeing the acetabular fossa or the acetabular cavity. It continues here now. This is the superior, the pubic region. Okay, for those who are not quite understanding what's going on. Okay, now let me draw the triangular acetabular labrum, the articular cartilage in the region where there is the articular surface. Over here is the transverse acetabular ligament. Attached to it and to the fovea is the ligamentum teres femoris. Over here is the Haversian pad of fat. Now taking a green colored pen, I want you to draw the capsule, which gets attached along the edge and then gets attached to the neck of femur. You can see some fibers rising upwards, forming what is called as the acetabular retinacular fibers of the capsule. These are the retinacular fibers. Taking a red colored pen, draw some blood vessels here, indicating the retinacular blood vessels which supply the head of femur. Cover the head of femur here with the articular cartilage. Now taking a blue colored pen or whatever color you prefer, color all the cartilages. So here's your articular cartilage, here's your articular cartilage. Take a much darker color and color your acetabular labrum. Why? To ensure that in your brain you register that these are two different types of cartilage. Ligamentum teres femoris, transverse acetabular ligament, Haversian pad of fat. Okay, so and just draw a few dots indicating that this is a collection of fat. Okay, it's not a homogeneous body. Now take some other color, I prefer orange always, and begin to line your joint with the help of synovial membrane. All surfaces of your hip joint which are not lined by articular cartilages are lined by synovial membrane. This includes your ligamentum teres femoris and the Haversian pad of fat. There, that completes your diagram of the head of femur. If you want, you can color the femur, indicating that's the femur participating in the joint. Students, now I want you to sit and ponder on what all you've learned here. Okay, let's see. You've learned the attachment of capsules of the hip joint. You've learned about the retinacular fibers of capsule and retinacular blood vessels. You've learned about two types of cartilage. Articular cartilage lining the acetabulum as well as the head of femur, and acetabular labrum deepening the acetabular socket. You've learned about Haversian pad of fat present in the acetabular fossa. Ligamentum teres femoris connecting the transverse acetabular ligament to the fovea on the head of femur. That's quite a lot of understanding in barely 5 minutes. Besides this, you can use this diagram later in your exams to draw while giving your theory answers. So we've got only 3 ligaments left. Before we go into this, I want you to understand that your hip bone is made up of 3 separate bones: ilium, ischium, pubis. So from each of these, which as you know were 3 separate bones in your when you were a fetus, each of these gives a ligament to the femur. So there will be an iliofemoral, there will be a pubofemoral, and there will be a ischiofemoral ligament. Got it? So that's all we are going to study. Iliofemoral, pubofemoral, ischiofemoral from each of the 3 parts of hip bone. So let's take a look at the beautiful iliofemoral ligament. Nice part is it's very strong. Okay, it's also called as the ligament of Bigelow. And the amazing thing is that so many times the hip bone gets fractured, the femur gets fractured, but the ligament does not get torn. It seems because it has more resilience, it's very strong ligament. Okay, and it has got an inverted Y-shaped structure. Take a look. It has a vertical limb and an oblique limb, both attached to intertrochanteric line. Similarly, from the pubis, you've got fibers coming down towards the intertrochanteric line, blending with the capsule. This is your ischiofemoral coming from the ischium and blending into the capsule. Right. So let's revise the ligaments of the joint now. These are the ligaments that you have studied. There are 8 of them. Revise them once to have good concept of these ligaments. Let's take a look at what we studied today then. We studied another name for the joint. Tell me quickly, what is another name? Acetabulo-femoral ligament. We classified the joint. Remember, we classified it by understanding, not by marking. Then we discussed the bones forming the joint. Then we discussed 8 ligaments of the joint. Not only we enumerated them, we described them. So you must be wondering, ma'am, you've done so much, what is left? A lot is left, dear students. We have to discuss relations, movements, blood supply, nerve supply, and so much of applied anatomy. That is going to be a part of my next class, which is hip joint part 2. I request all of you to watch that video as well if you want a complete understanding of hip joint. Okay, so all right, let's see you across the screen. If you enjoyed this lecture, do like and subscribe to the channel. It will encourage me to make more of these informative videos for you. I loved taking this class. I hope you enjoyed it too. See you across the screen in some other video, students. Thank you, and it's a bye.